Welcome, everyone. It has just turned to the top of the hour. I am here in Ronan, Montana, on the Confederated Salish and Kootenai Tribal Reservation Nation. And I, on behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Anna Whiting-Sorrell, and I work for Kaufman and Associates, and I will be your moderator today. Today's webinar is titled Tribal Outreach and Advocacy. Please note that this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenter and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. With that, I'd like to welcome everyone to today's webinar. Our presenter I'd like to introduce is Catherine Romero. She is the Tribal Program Specialist at the Northwest Regional Council, serving American Indian elders in 2 counties in the west side of Washington. In her role as the Tribal Program Specialist, she provides information, assistance, and help in finding culturally appropriate care for elders who are in need of personal care and other assistance in their home. She also acts as an advocate for the needs of elders who are experiencing barriers to accessing necessary services. So Catherine, with that, will you go ahead and welcome to this webinar.
Good morning, everybody, and thank you, Anna. Thank you for having me here today. I'm happy to be here. And thank you, everyone, for taking the time to be with us today. Like Anna said, my name is Catherine Romero. My ancestral name is Tispato Huchtalum. I am a member of the Nooksack Indian tribe that's located in the Pacific Northwest of the state of Washington. I joined the Community Programs Department here at Northwest Regional Council at the end of April of this year. And so I'm fairly new. Before I worked here, I previously worked as the general manager and overseer of government operations for the Nooksack Indian tribe. But now in my new role, I am still continuing to foster ongoing collaboration with the 6 local tribes that we serve in Whatcom and Skagit County. I hold a bachelor's degree in human services and rehabilitation and a master's degree in public administration and tribal governance. And I am currently working on a Doctor of Public Administration degree with a research focus on preparing for aging in Indigenous communities. Just a little bit about myself and my background before we get started. So I'm here today to share a little brief highlight on what we do here at Northwest Regional Council in the tribal programs position. Today I'll be sharing with you the culturally appropriate services that I get to help facilitate and coordinate at Northwest Regional Council. I'll be talking about some technical assistance that we provide here, and the support that we give to elders and caregivers within the tribal communities here, and also some new programs that Northwest Regional Council has to address and plan for dementia in tribal communities. Northwest Regional Council Tribal Program Specialist. It's a pretty vague title, and we do a lot here. I am, like I said before, I'm new to this position, so I'm still learning the ropes here, and there's just so much to do. The Northwest Regional Council has been here since, I believe, the 70s, and they are pretty well grounded and have a good system here, and a lot of programs, a lot of resources and supportive services for the communities here in Whatcom and Skagit counties. So there's a lot to learn. So what I've been working on is building working relationships with healthcare staff at the local hospitals, as well as the healthcare staff, providers, and program staff at all the 6 different tribes we work with, and as well as the leadership at the 6 different tribes. Just really building a strong relationship with the tribes and the community so that we can all work together to provide the best possible services to our aging adults here within Whatcom and Skagit County. The 6 tribes that I work with here at Northwest Regional Council are the Nooksack tribe, the Lummi tribe, Upper Skagit, Samish, Swinomish, and Saxuato. We really value our relationships with these tribes and do everything we can to make connections with the staff and the community and the elders to maintain working relationships and build that trust with them so that we can get out there and be more effective with our home assessments, our home visits, and the resources that they need to enjoy aging. And I also, as the program specialist, I also help coordinate services for Native American elders and people with disabilities. And our main focus is to ensure that we're using culturally appropriate delivery methods. I get the honor to assist other caseworkers and program specialists here at Northwest Regional Council when they have to go out into the tribal communities. I get the honor to go with them and provide that sort of advocacy and liaison role in those situations. So I attend a lot of home visits. I conduct interviews with tribal elders to really get to know them and their culture, and bring that back to the organization and share that with our caseworkers so that they can be more culturally competent when they're working within the tribal communities. And then I get to just be an advocate to ensure that tribal elders are receiving appropriate services. This position was created to enhance the service delivery in tribal communities, and it was also created per the Washington State American Indian Administrative Policy number 7.01. And many of you may have heard of the term 701 plan, and that is a document that many of our government organizations and agencies are mandated to develop and coordinate and implement in compliance with the Washington State Centennial Accord and the Federal Indian Policy as outlined by an executive order and the presidential memorandum of January 26, 2021 by President Obama. And so that's just a commitment that we will provide consultation and collaboration with the tribes. And so the Northwest Regional Council's goal is to provide human services that will have positive impacts and improve the quality of life for those we serve. And the 701 plan allows us to work together at the state, tribal, and federal levels to ensure that this is a positive and collaborative effort made by all of us involved. So like I said before, there are a lot of things that we do here at Northwest Regional Council, and we do a lot of collaboration with other local agencies and tribal programs. So some of the technical assistance and information that we provide are, as a program specialist, I help by connecting clients to the appropriate staff and making referrals to ensure that the ball isn't dropped and nobody's kind of lost in the whole application process of services here at Northwest Regional Council. I help coordinate and lead the efforts to reduce barriers to service accessibility. A lot of the applications for services and resources can be quite lengthy and burdensome, and it's a lot of work. So sometimes they just need a little bit of help getting through that process. And that's what I get to do within our tribal communities and applicants and caregivers. The caregivers program is also pretty hefty. I provide assistance and information regarding the available programs and services here at Northwest Regional Council. And I also try to get to know what other resources and services and programs are available in the surrounding agencies, local agencies here in Whatcom and Skagit County, so that if there is a need that we can't service here at Northwest Regional Council, I like to try and find alternate resources to refer applicants to. I act as a liaison with off-reservation community groups, and what that means is, even though there's 6 local tribes that we work with within Skagit and Whatcom County, we also have those other tribal members from Alaska or just other federally recognized tribes, or if they identify as a Native American, we also help them if they are in our service area. I serve as a liaison between the Northwest Regional Council and the Washington State Department of Social and Health Services and the tribes. And I provide information, resources, and supportive services to help guide end-of-life decisions. And we do have a lot of advanced care planning resources here at Northwest Regional Council. And I have recently started training and certification programs to become a certified death doula. And more technical assistance and information that I provide are one-on-one assistance to elders in tribal communities. And again, like I said before, that's mainly to help them through the application process for COPES, which is the caregiver program. And one of our priorities is to keep our elders at home rather than in a nursing home facility. I get to help provide assistance and case aid activities in coordination with Northwest Regional Council case managers and the DSHS personnel. I conduct home visits with tribal elders and just really try to get to know our tribal communities and how we can better serve them and get our resources out there in a more culturally appropriate manner. I coordinate training and workshops in tribal communities for caregivers, staff, and community members. And I participate and engage in tribal task force meetings. This helps our most vulnerable tribal elders get the resources, support, and assistance that they need to live in the comfort of their own homes or in a good quality facility if they wish, or if that's what they need. So long-term healthcare services. The caregiver support. So the tribal program specialist offers the following types of caregiver support. This is a really big program and a very big need in both Whatcom and Skagit counties in general and in tribal communities. There is such a shortage of caregivers. So I'm always looking for caregivers who are interested in joining the team to provide caregiving services to our elders and adults with disabilities. And with that, we have the ability to provide assistance with Medicaid and healthcare coverage applications, provide applicants with information regarding tribal exemptions, and to go a little bit more into that, the details of that. When you are on COPES, there is a caveat in the program that the state can use your estate as recovery. There's a estate recovery program, but tribal applicants are exempt from that. And I can answer more questions in detail later anyone would like. I help coordinate respite care for family caregivers. And through the Caregiver Support program, I provide unpaid family caregivers with information and training opportunities. The unpaid caregivers are often a priority because that's often family and friends who have always been the primary source to help those with long-term care needs. And oftentimes they're the backbone of the tribal in-home care system. So we just really like to make sure that they're getting the support and resources they need to take care of themselves and their loved one that they're providing care for. And like I said in my introduction, that Northwest Regional Council has some new programs here, fairly new, definitely new to me. The new Dementia Support program. And this is really important for our tribal communities and tribal staff and tribal leadership to get to know and be aware of, because statistics show that our tribal elders are living longer. And that just means that we have to plan and prepare for the increase in the tribal elder population. We'll begin to see illnesses and challenges that we've never seen before, such as dementia or cognitive decline. And this is simply because our elders didn't live long enough for us to experience these types of challenges. So Northwest Regional Council provides supportive services and educational resources to elders living with dementia and their caregivers. Through my position, the services that I get to provide are the Montreal Cognitive Assessment, which also is known as the MOCA. And this is a free cognitive screening tool used for early detection of mild cognitive impairment. So this is not a diagnosis tool. It's just an assessment that I get to facilitate with a tribal elder or a tribal adult with disabilities to give them an idea of concerning areas of cognitive decline, and they can then take that to their healthcare provider and get the services and care that they need to further examine their cognitive concerns. I am also a part of the Dementia Friends program. I've done the Dementia Friends in Indian Country workshops. And what Dementia Friends is, it's a campaign to tackle the stigma and lack of understanding around dementia. And the objective is to get more community members involved, educated, and aware of dementia so that our loved ones can continue to live in our communities in a meaningful way. And right now I am partnering with the Northwest Portland Area Indian Health Board to coordinate and facilitate a Dementia Friends session here in Whatcom and Skagit County. And I am also working on a dementia caregiving training tool to be able to take it's called Savvy Caregiver, that's already in existence. And what I'm doing with that is taking that and tailoring it and modifying it so that it's more culturally appropriate and specific to the 6 tribes that I work with here. And that is to provide caregiver training to the caregiver and allow them to learn methods and tools to provide caregiving services to those that are suffering with dementia and cognitive decline. And I am also doing a lot of research on dementia in tribal communities. And with that information, I am hoping to share that with tribal leadership to help so that they can be more strategic in making plans to address dementia in their tribal communities. So that's a little bit about the work that I do here at Northwest Regional Council. Like I said before, I'm fairly new. I've been here since the end of April, so I'm still learning the ropes and getting to know everything around Northwest Regional Council. But my ultimate goal is to provide meaningful services to our elders, as well as provide information and research to tribal leadership and the community so that they can plan for the future to make positive social change and make programs to address health disparities and enhance the quality of life for our aging population in tribal communities. If there are any questions, I would be happy to try and answer.
So, Catherine, there are no questions in the chat box or in the QA box. So I'm going to ask if Christina or Nicole, do you have any questions you'd like to ask? And we can begin that process. If you do have a question, remember you can put it in the QA box, or you can put it in the chat, or raise your hand, and we will be able to unmute you, and then you can ask the question. So Christina asked, could you talk a little bit more about the process of developing working relationships with tribal staff, leadership, and elders?
Yeah, so I have been reaching out to the tribal staff who work with elders specifically. And for every tribe that looks different. Sometimes it's a social services director, elders director, or elders program coordinator. Yeah, so just getting to know how those different tribal organizations work and who they are and what their resources and services are that are available to their communities. And then just getting right into the details so that I can have a better understanding of what they have available, if it's specifically for their own tribal members, or is it open to all tribal members, regardless if they're Nooksack, Lummi, Soxhawtl, Samish, whatnot. So, and then getting familiar with their leadership and what their priorities are so that I can reach out to the appropriate tribal leader. There's a tribal leader that specifically works with social services or elders programs. I want to reach out to them and get some information in their ears about the services we have here and how we can better collaborate and build more meaningful relationships that enhance the quality of life for our elders.
So we have a question in the QA box, and it says, how long has a tribal specialist or similar position been at NWRC?
Northwest Regional Council has had a tribal specialist, as far as I know, from my previous work. I worked with Becky Bendixson, who was in this position before me, and she had been here at least 15 years. So it's been quite some time that they've had a tribal program specialist. The exact amount of time, I'm not sure.
All right. Someone just thanked you for the work that you're doing and being able to be in this webinar today. I'd like to go back and ask a little bit more about the first question that we got, and that's, about building relationships. How do you find, what is the best way to build relationship in Indian country or with the 6 tribes that you work with?
I feel like it's different for every tribe. Just to get my foot in the door, I make a lot of phone calls and send a lot of emails, just introducing myself and letting them know that I'm here and what I do, and just trying to make connections with the staff so that I can get out into the community and get to know their elders, attend some elders lunches. I know some tribes are still not allowing face-to-face meetings or gatherings. So that has been a challenge, but yeah, just trying to get to know who's working where and who's who, and how I can get my foot in the door to meet everybody. So for instance, next week or the week after, I'll be meeting with Lummi, with the Lummi Nation, and they have made a whole big deal about it. So I'm going to bring some of the team here from Northwest Regional Council, and they're going to bring their social services team, their elders team, their healthcare team, and we're all going to get together and just do a meet and greet and get to know what we offer and what they have and how we can coordinate our services together.
Well, while we wait, then another question has come in. Are clients and their families ever reluctant to have someone come in and provide help in their homes? And if so, how do you navigate that?
Well, I have not ran into that challenge yet. I imagine that does happen. One of the good things about this position and me being in it is I tend to have some good relationships from our cultural activities, our cultural ceremonies, and our community relationships. I already have a personal relationship with a lot of elders within our tribal communities, so that I'm kind of a familiar face. And my family being so big and being related to so many people, I haven't run into that challenge of anyone being reluctant to let us in. One good thing is when the caseworkers who have to go out and do an assessment, when they find out that there is a tribal liaison who can come out and provide support to the family, and they find out who it is and it's a familiar face, a familiar name, they're more inviting, I guess is a good way to put it. But if they are reluctant in allowing us in the home, in some situations, we have to be in the home to do an assessment on the home. If it's if they need services for any home modifications, obviously we have to get into the home to see, to conduct that assessment. If it's a healthcare or caregiver needs assessment, we can do that here in the office as well.
Yeah, I think having a relationship is so vitally important. I know. Heather, you do you have your hand raised? And if you unmute yourself, you can ask that question.
Yeah, hi, can you hear me?
Yeah, we hear you well.
Great, sorry, our internet is here on the res, it goes in and out. Hi, my name is Heather Mace, and I'm an elder advocate in a CHR community health rep for Kamau Medical Center in Hoopa, California. I've been here for 16 years this month, and so my question is, I know that we run into a lot of different things on. My concern is that I have a hard time with getting is we have this in-home support services that we have through Humboldt County IHSS services. And a lot of our patients, a lot of our elders, which we work from 65 and up on the reservation, we have a hard time with. If they qualify for Medi-Cal, then they qualify for in-home support services. But if they don't qualify for Medi-Cal because they make too much, even on their SSI, or they have a pension from their husband or whatever it may be, they don't qualify for the in-home support services. So that, it puts a lot of our elders that are actually home alone, that don't get a lot of help and support. So I don't know if there is a program out there that, that could help with those, with those elders, or those resources to help with, to get our elders just, even just coming in and, taking, cleaning their, doing some little dishes, or starting a fire for them, or just be able to have a couple hours a day to be able to assist those elders. We have a lot of elders that live alone. So that's something I've been really trying to reach out with with the tribe or services from Humboldt County, and I'm just having a rough time with them. So
Yeah, that is unfortunately a very common situation where a lot of our tribal elders, even with fixed income, are over-resourced because of the amount of money and resources that they can have in the bank or at home puts them over the eligibility limit, and that leads to situations where family members are left to care for their elders unpaid, and that's usually not feasible because a lot of everybody has to work, everybody has bills to pay. So what some of the tribes are doing now is they are collaborating with the state for those who are not eligible for a paid caregiver. Some of the tribes are now developing their own caregiver support program where they will pay caregivers providing care for tribal elders in their community. Not all tribes are doing that. It is a budget impact and a budget discussion that is totally up to the tribal leadership to take on. But that is one way that some tribes are addressing that issue.
Yeah, thank you, Catherine, for that. We have another question. Do you suggest more organizations hire on more tribal liaison specialists?
I do agree with that, simply because the tribal needs are so unique in tribal communities. The health disparities and challenges, and even the equal access to healthcare services, I feel like tribal communities are at a disadvantage, and the services are lacking in a lot of tribal communities. So yeah, a tribal liaison helps enhance advocacy and that liaison work that ensures that the tribal communities are receiving equitable health care and services and resources that are out there available to them.
Generally speaking, how receptive are family caregivers to the idea of respite care?
Well, once they find out respite care is available, a lot of them are receptive to it because we never like to think of our loved ones as burdens, but family caregivers need a break too. They need to, and that's what we like to focus on when we support caregivers is self-care, getting the help that they need to support their mental health and their well-being as well, so that they can continue to provide quality caregiver services without burnout or stress.
Yeah, I think oftentimes we forget how important self-care is, and especially for caregivers, how important it is that they take the time to fill their own cups so that they have more to give. And we can't do that from an empty cup.
Exactly. And there is a new local nonprofit agency here in Whatcom County that is now providing caregiver support groups.
Oh, wow, that's interesting. Support groups. Yeah, that's so important. So
yeah, and they open it up, the caregiver support group. It's designed to provide support and resources to the caregiver, but it's opened up so that they can bring their children if they need to. And a lot of times it's a workshop event where they're sewing, they're crocheting, they're knitting, they're making drums. It's kind of like an arts and crafts therapy type of support group for caregivers. It's actually really neat.
Oh, wow, that sounds wonderful. What is the best way to establish new connections with tribes that you serve. So what is that first, what do you do for that first outreach to a tribe or a new tribal employee? It might be even.
Yeah, so when I got into this position, this role here at Northwest Regional Council, I was pretty familiar with a couple of the tribes because, well, my sisters and my family work there. But there were a few tribes that I didn't know anybody. And that was the challenge. I first looked them up online, got to know what their organizational structure was. You know, a lot of tribes have health directors, they have health managers, they have elders coordinators, elders directors, elders managers, and just getting to know what their organizational structure is, and then reaching out to find out who's doing what are their roles and responsibilities, and how can I help them coordinate and collaborate services and resources, and try to get my foot in the door to do a site visit and meet them face to face, and just really start building relationships, and so that they know I'm here and I'm here to help and happy to help, and we all have the same goal, same mission, to get the resources and services we need to enhance the quality of life for our elders. Some tribes do require like a memorandum of agreement or some sort of working agreement, which is okay. We can do that too. That just requires a lot more steps, but I get it. There's systems and processes in place, and every tribe is unique.
All right, so I don't see any more questions in the QA box or in the chat. Does anybody have something that they would like to ask, or if you want to raise your hand? So we just got another one, and it is, are you a resource for us to use?
Absolutely. I don't know everything, and I don't pretend to know everything, but if you contact me and you need help, I will do everything I can to provide information and assistance where I can. And if I can provide a referral or an alternate resource, I'll do my best.
All right. And we'll remind people that this webinar is going to be, will soon be uploaded onto the cms.gov website sometime in the near future. So Nicole, I see that you have a question. Could you ask it? Do you want to ask it out loud?
Sure, yeah, there's a question. You mentioned being a certified death doula. How have you been able to provide these services in a culturally appropriate way?
So I'm technically not certified yet. And within my own tribal community, I do a lot of, in my own personal life, I am a tribal minister. So I do ministry work within our tribal communities, which is weddings, baptisms, funerals. So when it comes to a death doula, I kind of do some of that work already in my personal time within my own tribal community. But the death doula certification just kind of takes it a step further, where I'm learning all of the laws that surround death and funeral planning, and a lot of the different protocols and processes that our people have to go through, such as power of attorney, learning all of the protocols and the laws surrounding how to get a power of attorney, and medical directives, the DNRs, and the consents that the healthcare providers need or the hospital might need. And then also learning strategies and techniques to help have those difficult conversations with the family when it comes time to make very hard decisions. And then after death care, being able to facilitate conversations, mediate conflicts, and just kind of be a support person for the family during that time after their loved one passes away. And then when it comes to funeral planning, there's a lot of laws and licenses and permits that need to happen before they can move forward with the funeral service. And in our tribal communities, you know, we have usually it's 4 days that we go by to finish our funeral services. So yeah, just learning all the different protocols, procedures, laws, permits, licenses that are required so that I can help better facilitate those funeral arrangements and planning for families here with the tribes I get to work with. Northwest Regional Council has a lot of advanced care planning resources. And so the death doula certification is kind of like a bonus, I guess. Get to help in not only here in my position as a tribal program specialist, but also as just a tribal community member. Thank you for asking. And there aren't many death doulas in Whatcom and Skagit County. I've had to do a lot of training in Canada.
Are there other tribal liaisons or other tribal people that you're working with as you get this certification?
No, there are. I'm not aware of any certified death doulas in tribal communities.
Very, very hard work, but so vitally important to our tribal communities. So,
and it is a very challenging discussion to have, because a lot of in our cultural ways, we don't like to plan for our departure, our journey to the other side. But on the other side of that, I've helped many families who were not prepared and did not have plans. And it makes things for the family left behind a lot more challenging and a lot more difficult. So getting the estate planning in place, and we even have advanced care planning resources that help our families and loved ones plan and outline their final wishes and how they would like things to go.
yes, they're very fortunate to have you, Catherine. Are there any other questions that someone might have? All right, well, with that, it seems as though we've answered the questions, and someone just wrote on, just wanted to say that it has been very interesting. Thank you very much. With that, I'd like to thank Catherine for joining us and having this really important discussion. Thank you again for joining today's webinar. Our session is now concluded. Thank you, everyone. Thank you.
Thank you, everyone.